10 years ago, when I was an undergraduate design student at university, I would have never imagined that I would be here today to speak to you about how designers have been using design to directly address some of our society's most pressing social challenges. But in the past 3 years, I've had the opportunity to research and observe a number of projects where designers have been using design to create a positive social impact on the lives of people, communities, organizations, and government. And today I'm going to tell you one such story that I've come across, and it is a story about a small group of designers who use design to significantly improve the lives of people with dementia and their carers. Dementia has a devastating effect on people. Dementia is a disease which progressively affects the brain tissue and a multitude of functions that we often take for granted. For example, if someone has dementia, they often experience memory loss or a decline in their communication skills. But dementia doesn't just affect people, those with the disease. It also affects carers as well. And these are often people we call informal carers, that is, family and friends of the person affected. And because somebody with dementia can live for up to 12 years after diagnosis, dementia care can be a significant undertaking. But dementia is not just a country-specific issue. It is a global one too. And some of you might have seen this just last week when the World Alzheimer's Report was published and went to press to say that almost 36 million people around the world this year are living with dementia. And by the end of the year, the cost of dementia could top 1% of the world's GDP. That is, all our societies combined, the cost of dementia could cost the world 1% of the world's GDP. That's a lot of people and a lot of money. And we should expect nothing less than truly innovative responses for how we shall meet the future challenges of dementia. In 2009, just last year, this is what the UK government set out to do. They launched the country's first ever national dementia strategy. And that's it on the screen, the front cover. The strategy outlines 17 recommendations, which, if implemented, will significantly improve the lives of people with dementia and their carers. And it is one of these 17 recommendations that was inspired by a project led by designers in 2007. And this project was called Alzheimer's 100. Alzheimer's 100 was led by a team of designers at social design agency Think Public, who worked with the charity, the Alzheimer's Society, to create ideas around what the future of dementia care could look like. The project was one of many under a design innovation program called .07, and .07 was a program that was established by the Design Council, who were tasked with promoting the value of design throughout the UK. Now, to introduce you to this project, I've got a short film to show you. It was made by designers at Think Public alongside people with dementia and their carers, who not just featured in the film, but took some of the footage too.
My name's Alan Wager, and I can't remember what I memory's terrible.
You know, you get good days and you get bad days. You know, I think it happens to all of us.
Yeah,
like, you know, that
exactly.
we've got Alzheimer's now, and it's what gets me is it's when you get the bad days, and you can have like a big, you know, like it's not very nice.
things he's done for years and years, well, all my married life. He just cannot do it.
A lot of people probably don't know that they have these groups. I don't know how many groups there are.
The Alzheimer's, the Benefit Enquiry Line, Disability Gateshead, Gateshead Carers Association.
We missed out on a lot of that. I didn't have any support from any of the agencies that you can get if you know the right people.
I'd like to see people being able to partake in decisions more frequently about their care, and more importantly, being able to have some impact upon decisions before it becomes a crucial or essential or even a crisis.
Everybody's a little bit nervous, you know. We're all saying about creating or designing a service. Kind of now, you know, you're thinking, well, actually, you could do this. You know, we have actually got the abilities and the skills and the power, if that's not too strong of a word, to actually go out and change services and provide services for people.
If you're going to give something to somebody to use, it's got to be useful to them, and therefore asking them to help you design it has got to be the best way to create something that is useful and meaningful and actually has some longevity.
Many innovative ideas resulted from the Alzheimer's 100 project, but one of the key ideas was this one. This is a proposal for a dementia signposting service, and you might remember earlier in the film that people talked about the confusion and often lack of knowledge they had for support and services that were available to them. The signposting service is a response to this, and in brief, it assigns a person or a signposter who meets with people with dementia and their carers on a face-to-face basis to understand their specific needs and then signpost or navigate them to relevant support and services that are available. And you're probably wondering what an idea like this has to do with design. Because when we think of design, we often think about the creation of products, fashion, interiors, graphics, or buildings. But it is the creativity that makes these new products and ideas and the collaboration of people to make them happen that can be used to create innovative responses to how we might address our society's most pressing social challenges. And it is this added layer or approach of co-design which sees that designers design not just for people but with them, involving key stakeholders throughout the entire design process, from identifying the problem to generating ideas and to implementing them. And it is the methods of co-design that come from a designer's toolbox. And these methods are specifically to encourage the creativity and collaboration of people and involve them throughout the process. For example, in the Alzheimer's 100 project, designers used their design and communication skills to invite the participation of people to the process. Designers shared their creative skills, in this case in filmmaking, with people with dementia and their carers to co-design a 15-minute film that profiled daily life with dementia. Designers hosted a co-design day to bring together key stakeholders of the issue to co-design ideas for what the future of dementia care could look like. And then designers helped prototype these ideas to see if they were possible, to test and refine them, to ensure that they would fit into the lives of the people who would be using them. And finally, designers provided continuing design support to help realize these ideas and make them happen, such as the dementia signposting service. And it would be this signposting service that would inspire one of the 17 recommendations in the UK government's National Dementia Strategy. It reads, Objective 4, a dementia advisor to facilitate easy access to appropriate care, support and advice for people affected by dementia. Since the launch of the report last year, Think Public have continued to work with the Alzheimer Society to implement the signposting service idea. It has since been renamed Dementia Advisors, and these are some pictures of the advisors themselves and how the service works. The service works very similar to the signposting concept, where an advisor meets with people affected by dementia to provide support throughout their journey. An advisor is also supported by an advisor-maintained intranet and a handbook, both of which provide key information and knowledge about dementia services and support that are available. As I speak, and as we sit here today, Dementia Advisors is being implemented around a number of different sites across the UK. And in the coming months, the government will be evaluating it as part of the National Dementia Strategy. But the Alzheimer's 100 project is not the only project that I've had the opportunity to look at while I've been doing my research. A number of other projects that I've looked at have seen how designers have used design to address social issues in the areas of health, education, energy, food, mobility, employment, and improving local communities. And then no doubt there are many more areas and issues that are yet to realise the potential of design. And most of these projects that I've been looking at have fallen under the DOT program that I spoke about earlier. Today it was just about one story that I have come across that I hope has got you thinking a little bit differently for how we might use design in the future, whether you're a designer or not. And at best, I hope it's inspired you to seek out and explore the potential of design and designers in tackling our society's most pressing social challenges. Thank you.